Okay, so we're just recording right now. I guess some more people will join in a little bit. So I'm just going to do a little quick introduction about who I am, who our office is, and then Aviva will take over. So thank you all for joining us. We're really happy to be doing this again. My name is Rachel Hockman, and I serve as an Aliyah coordinator for English speaking olim at the Jerusalem Municipality. I'm one of four in the English group. So there's four people who do, I'm three more people who do what I do. And we have many different languages as well, but our focus is on the English speaking olim. And our office is here basically to help people pre and post Aliyah with any questions that they may have, any bureaucratic issues, if it's getting certain documents done, dealing with bureaucracy, finding an ulpan, a neighborhood. We have help with finding housing, rental housing in Jerusalem, synagogues, social events, really everything, employment, education, anything you could think of, we aim to help with. Our focus is the first year or two post Aliyah, or people who have been here for longer, but they're new to Jerusalem specifically. So if you've been in Israel, you've made Aliyah for a few years, but you're from a different city and you're new to Jerusalem, we also help with that. And we offer in-person meetings on Zoom, phone calls. Um, yeah, that's basically what we do. We're very happy to help. We're happy to get our name out there. Again, it's specific to Jerusalem. And yeah, I just want to say again, thank you for coming. If anyone has questions, please, you can write them in the chat or keep them for the end. We're going to have a Q&A for the last 10 minutes or so. And I'm going to put my email in the chat box. And Aviva, if you could put your email as well, and people could contact us with questions or concerns. If anyone would like to make a meeting with me or one of my colleagues at my office in Jerusalem or via Zoom, if you're not in Israel, we can also do that. And last thing I just want to say is if there is a siren for those who are in Israel, I'm going to turn off my camera and audio for however long that takes, usually 10 to 12 minutes, and then we'll resume after that. Okay, so please, again, keep your questions till the end. And Aviva, if you have anything else you want to add before you start, or if anyone has something technical that they need to ask before we start, otherwise, I think Aviva, you can take the
I'm
take the
gonna,
lead.
all right, I'm gonna go get started. Thank you so much. This is so fun to be back here again. I did a series a while back for Jerusalem, and then there was a break, and so I'm very glad that Rachel is back and brought us back in. It's very exciting. Um, and for those of you, I mean, I guess those of you who are coming in are new to Jerusalem, but you should know what a special thing it is that you have these special Aliyah coordinators. I mean, I remember back there was when there was one and then it went to two and now it's four, so it's very exciting and you shouldn't take it for granted. Not every city has this kind of service, so you should definitely be appreciative and take advantage of it. If you're not already in Jerusalem. Maybe I'll just take a moment here on the chat. If you guys want to just write in, for those of you, are you pre-Aliyah? Are you considering Jerusalem? Or are you already living in Jerusalem? Just so I get a sense of who, since we're a small group, who I've got here. You guys want to just take a minute? Anybody? No, everyone's going to be quiet.
I thought you wanted us to type it in. You want me to speak it out?
You can speak it out too. That's great.
Okay. My wife and I are pre-Aliyah. We are in the process of purchasing a property at Givat HaMatos, which is in Yerushalayim. It's a brand new community that's being developed as we speak. They're moving dirt and rocks and stones. And it's located just near Arnona and Ramat Rachel. So I'm doing lots of homework and investigating and gathering information, which I'm learning now may be OBE by the time we get there. But that's where we are right now. So we're on the road.
Very exciting. Wow, I have new community that I have not even heard about. That's very exciting.
Yep. The cranes are up and doing their thing.
That's very good. That's very good. And Gabrielle says he's coming very soon, in 2 months from now, a month and a half. Very nice. Okay. And Leah and company, are you guys are in Jerusalem, or you're coming to Jerusalem, or you're okay. So, okay, so good. So this is very actual for you guys because you are definitely need to access the Jerusalem community. So what I'm going to do is I wasn't sure, and I want to make sure that I gave you a lot of very relevant information in general for the healthcare system that is helpful for anybody, as well as giving you some specific caveats about Jerusalem and things to know, things to think about, or things to take advantage of. So I'll tell you right now that there's a lot of information here that I felt it was very important. But I know that we're recording this and they're going to put this up on their channel. So I urge you, listen to what I'm saying, jot down your questions, but don't feel like you have to understand everything. Watch it over again. If issues come up or questions come up when you watch it again, or something's not clear, you can always email me to clarify, etc. Uh, so just a brief intro to discuss who I am. So my name is Aviva, as you've seen, and I've been here for about almost 30 years at this point. In Israel, my background is actually in public health. So I have a master's degree in public health, and I worked in the field of public health for I don't know, the first 15 or so years of my career, but for the past I would say between 10 and 15 years, I've been more in the field of healthcare advocacy, helping people navigate the healthcare system, worked for a few nonprofits, and since Corona, I started my own business, really helping people navigate the healthcare system, specifically English speakers. And in addition to that, I'm also the primary caregiver of my mom, who I brought over my parents about 7.5 years ago, and my mom has dementia, and she lives with me with a caregiver. So I understand very much what it's like not only to navigate the system professionally, but also personally, also with my 5 kids and also with my parents. So I understand what it's like to be on the other side of the desk and the challenges that can go therein. So we're going to just start with a general overview of the healthcare system, just to give us an understanding of how things fit together. So the first thing that we have to understand is the Office of Bituach Leumi, which is responsible. It's like the government's right hand to be responsible for all of our healthcare rights and benefits. It's called the National Insurance Plan, and it really covers everything. So health and social welfare. And the government gives Bituach Leumi money, and Bituach Leumi gives that money to the 4 Kupot to be our healthcare service providers. And they determine what healthcare services are to be given to us for free. Or I say free, I mean, we pay through your taxes, and you can see the arrow on top. We all pay taxes, but for free, meaning because we all have guaranteed healthcare. They decide every year what services with imaging and therapies will be provided through that basket of services. Now, and they provide those services to us. However, we also have the ability to pay the 4 Kupot, to pay into our Kupa and get additional services that are not necessarily in the basket of services. Those are called supplemental health plans, and we're going to talk about that in a second and why that's so important. But from this, it's important to understand that we are all guaranteed our basic level of services through the healthcare that is given to us from the Kupat Holim, I should say from Bituach Leumi by way of the Kupat Holim. Now, again, it's very important to know what Bituach Leumi is because they give us so many of our social welfare benefits. So before retirement age, if we have a disability, then we get a stipend. If we have a child with a disability, we can get a stipend and additional discounts and benefits. If we have a baby, we can get maternity leave, and if we need to leave beforehand, we can get paid sick leave. Those are all through all through Bituach Leumi. If now we have miluim, so if for an active military reserve duty, that's also the payment comes through Bituach Leumi. If after retirement age, we have worked in Israel beforehand, we're eligible for pension. If we haven't worked in Israel, we're eligible for long-term nursing care benefits, as well as for nursing care assistance in the household. Now, it's important to understand that most of these Bituach Leumi stipends have two sets of criteria. One is medical. Do we meet the medical standard? And B, do we meet the financial standard? And we have to report those both to Bituach Leumi, and that's important to understand when we are applying for those benefits. This is, again, like a fast overview of the different types of benefits that we can get through Bituach Leumi for different age groups. I won't go into the specifics. I will tell you that if you are making Aliyah over retirement age, the two things that you need to think about that you could be eligible for would be what they call kitzbat siyud, or long-term care benefits. Yeah, let's say that for the most part is the long-term care benefits. That's what we're gonna say, because if you make Aliyah over retirement age, then you're not eligible for other types of benefits. Okay, so we have three main ways that we can insure ourselves in Israel. The first one, as I explained, is through Bituach Leumi. Everyone gets covered. Everyone gets their health care either through the Kupat Holim or through the Ministry of Health. There are certain items that we still get directly from the Ministry of Health. Everyone is covered. It doesn't matter if you come with a pre-existing condition. They cannot not cover you for something. And it's free in the sense that you do have to pay a small copay. You obviously pay taxes, but it's not something that you have to give out a lot of additional money in order to get your basic coverage. So this is true for going to the doctor, for a specialist. This is also true if, God forbid, you're, in an emergency situation and you need a surgery. And also for chronic illness, you have a cancer diagnosis, or if you have a chronic illness and you need to go to the hospital, you need to have treatment, you need to have medication. All this is covered under the main provider of the basic health insurance from Bituach Leumi. Now, the next option that we have is something that the government created in order to create competition among the 4 kupot, and also to provide for you an additional level of coverage if you have the financial ability to do so. This is called Bituach Mashlim, or supplemental care, and I call it semi-private because you are paying a monthly fee for it. However, it is from the Kupat Holim, which is the public service, but it is affording you additional services that are not in the regular basket of services, as we initially mentioned in the first slides. We purchase it through the Kupat Holim. It gives us the ability to pay for a doctor privately, to also buy to get medications that aren't in the basket of services, as well as paying privately for a surgery where we're only paying a copay to the doctor's private fee. What do I mean by that? I mean that in a regular day, just with the regular Bituach Leumi, let's say you have a hernia and it's not an emergency, but it's uncomfortable, and at some point you're going to need a surgery. If you go through the regular Kupat Holim, you will go to a surgeon. He will say, yep, you definitely need surgery. Go to the hospital, because it's the hospital system where you'll do the surgery. He'll give you a referral, where then you also procure something called a hitchayvut, or a voucher from the Kupat Holim, which says, oh, okay, we'll pay for that. And they send you to the clinic. So the general surgery clinic of the hospital, you make an appointment with them and you see who's ever on duty at that day. The person on duty says, yep, you need a hernia. okay, go here to the secretary, make an appointment. You make an appointment for 4 months from now for your hernia operation. You will come in, you will do the post-op. You will not know who your surgeon will be until the day of the surgery. But everything will be paid for other than the 38 shekel copay that you have to pay for the voucher. So the benefit here is that it's all covered. The negative is that you don't get to choose your surgeon. You don't necessarily get to have a relationship with them before or ask questions thereof, etc. So that is why, for the additional copay of the supplemental insurance, I recommend, and I think it's quite worth it to have that additional copay of around, it's about between 100 and 150 shekels per person. And you get the opportunity to choose their surgeon when you need to. So that's the additional coverage. Now, the good thing about that is even though it's supplemental, the Kupa must give it to you. They have, even if you have a pre-existing condition. And I thought it interesting to just check out is that the overwhelming majority of the Israeli population has this insurance, meaning it really doesn't matter which socio-demographic area you are from. Almost everybody at this point realizes the benefit of having this type of supplemental insurance, and they purchase it. Now, the most important thing is for those of you who haven't yet made a Aliyah, if you purchase this within 90 days of making Aliyah, there's no waiting period. What does that mean? Usually when you sign up for an insurance, right, you sign in, they're like, okay, and come back to us in 6 months and we'll tell you, what benefits to come. Come back to us in 2 years and we'll tell you, okay, now you can get that medication, now you can have the private surgery, etc. If you purchase it within 90 days, there's no waiting period and you don't have to worry about that. So that's why I think it's a very important thing to do from the get-go. And the last row, sort of the last track of insurance is the completely private provider. You purchase it completely privately. You have to pay for it monthly. Sometimes in some workplaces, they'll give it to you at a subsidized rate as a benefit. They can reject you from any pre-existing condition that they want to. And they've changed the law in the past, let's say, year and a half. So now the policies are different and they start, meaning they're not going to double up on what you have from before, from the supplemental. They're going to cover from what you don't have forward. So the policies are a bit different, not as comprehensive. And again, they are extra payments. So I get the question all the time, whether or not I think it's worth it to buy this insurance. So here I say, just like any insurance, anytime, it comes down to a lot of your personality. The level of risk adverseness that you have, the level of how much do you want to be covered, even in the most statistically marginal of cases. It's a very personal thing. I'm not sure that overall, statistically, on a lot of these policies, the benefits outweigh the payment. Again, there are a lot of different policies, and depending on the agent that you encounter and your age, because the younger you are, obviously, the more attractive you are, so the better policies they're going to provide to you. I don't know if they're worth it, and I'll tell you also why, because really the majority, what gets us as we age is not the catastrophic illnesses for the most part. It's the little things. It's the wearing down of our activities of daily living and our need for more and more daily assistance at home with the small activities. So better to invest in something that's going to get us what we call, sort of long-term nursing care than necessarily catastrophic coverage. But again, this is a very personal issue. So it's also important to understand that we really work on two levels here in Israel between the public and the private system. The public system, as I told you, that's through Bituach Leumi and subsidized paid for with the 4 kupot, and the private system that I mentioned that you could take advantage of. And basically what you're going to be doing is really sort of using both systems, sometimes braiding them together, sometimes separating them, finding a balance. And when you're going to use each one really depends upon the need that you have. Do you need a diagnosis? Do you need good bedside manner? Or do you need an immediate prescription? Do you need a referral to the next step in your process? So I'm not going to go into the specifics because I don't want to overwhelm you, and I'm not sure that it'd be helpful to give all the information, but I urge you again to take a look at this presentation and read the text that's written, and sort of even after you come and you've seen the system, come back here. This will make a bit more sense. But it's important to know that you're using both of these systems when you have the semi-private or the supplemental insurance. And if you've got specific questions about that, then write them in the chat, or you can ask me at the end, and I'm happy to do that. The most important thing that I can tell you right now that a lot of people don't understand is that if you see a doctor privately, meaning let's say you go to see him, we'll talk about this in a second, at Hadassah in Karam, the hospital that I had at the beginning of my slide, you see them after the hour of 3, which is when the private services start. So you've made an appointment for a specific doctor. That is good, helpful information, but you can't use that to get a referral in for like the next service. So let's say you see the doctor and he says, you know what, I really think that you need to do an MRI. His suggestion is not enough. You have to make sure that you have a specialist in the Kupa who will give you the referral for the MRI. So that's why it's very important to use 2 of the systems at the same time, so you have a specialist in the public system who you can make appointments with, even when you see the specialist in the private system. So I always tell people, make sure that you have appointments for both a private specialist and the public specialist, even if the public specialist will be in a few months away, because you will need that person later specifically for bureaucratic processes, and you want to have access to them. Okay, we're going to have a brief moment here on doctors in Israel. I get this question all the time. How do I find doctors? So first of all, each Kupa has a search engine that you can use, which is very important. Everybody uses Facebook groups. There are some WhatsApp groups as well that you can join, that people give recommendations to one another. We started our own called israelmd.com, which is sort of in its beta phase. But we're working on that to get more and more information out about English-speaking physicians, so people can give their input onto those. But the most important thing that you can remember when you want to find a doctor is, what is my goal of this appointment? What do I need to get out of it? Because that will determine what type of doctor, public or private, who you're going to look for recommendations. Is it something very simple, like I just need a prescription refilled, or I need a new prescription? Or is it something much more complicated, like I really want to explore my situation because I don't have a diagnosis? So that is really important to consider when you're looking for a doctor. Now, the most important thing well, I shouldn't say the most, one of the most important things before you go to the doctor or during the doctors is the feeling of you need to shop around. And I feel like, especially, I don't know, people, especially Americans, sometimes have trouble with this. Is they go to a doctor and they're very frustrated, or they're very disappointed in the manner of the doctor. But that doesn't mean anything. Okay, so there's plenty of options, and you will find somebody else and you'll make another appointment. Sometimes you have to go, and the more complicated your problem, or the maybe more doctors that you have to go to till you find somebody who's going to suit your needs. So don't be thrown off by that. You do your homework, you do your due diligence, but sometimes you just have to keep shopping around. It's like anything else. It's a service-based industry, and that person might not fit with you. Also, when you're going to specialists, I remind people to bring your recent blood tests, bring your imaging reports. Do not rely on the fact that everything's in the system. Why? Because sometimes it's not. Also, sometimes the doctor's computer isn't able to access it. If you've come from another Kupa or another city, sometimes they won't be able to access it. But do not bring the entire, like national archives of your medical history from America for the past 10 years, because that's not going to help you either. So what you do is, let's say you've just come, you're about to make Aliyah, select the most recent summary that you have. So in the past 6 months of each specialist that you have seen, and your corresponding blood test or image test, preferably 1 page to 2 page letter summary from the doctor, together with the summary of your results, your test results, blood tests, imaging, etc. The third thing is very important to always write your questions down. I have a thought that there's definitely an algorithm. The longer that you've waited for this doctor's appointment, the more you forget about what questions it is that you wanted to ask them when you get there. So write them down. Write them down. And if the doctor gets frustrated or you don't have time, like don't worry about it. That's not your issue because you need to ask your questions. Also, don't go by yourself to the doctor. I'm not talking about the family doctor, but I'm talking about any specialist. You need to always go with somebody else because they need to hear they can hear the things that you don't. Maybe they'll think of a question. Maybe they'll remind you of things that you had thought about or were difficult for you that you had forgotten. Or also, it could be a language thing. So make sure that you bring somebody. And especially, and I tell this to people who are making Aliyah and they have adult children living in Israel, and I hear it all the time, is, well, I don't want to trouble them. Adult children, it's still their job. It is that's something to do. You're here and they need to be helpful. And you need to have somebody go to the doctor with you to help you with the language sometimes, to help you to understand the system. So it doesn't have to be every week, but it definitely should be on the agenda that your children will go with you, especially if you're going to have complicated doctor's appointments. And the most important thing is anytime you leave any doctor's office, you must get the printed copy of what we call the Sikum Bikur, which is the summary of the doctor's visit. And that is crucial, 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 because you will bring that to another doctor. You might need that for a referral. If you are going to apply to Bituach Leumi, you will need that. Always get that little piece of paper in your hand. Some doctors are still back in, I don't know, the beginning of the 20th century and still don't type. And they send their notes to their secretary and they email you. These are for private doctors. Some of them still do this, but they will email you the summary and make sure that you verify that before you leave the office, but never leave the office before you get the summary of the visit. Okay, now a brief word about emergency care, because this is very important. In Jerusalem, okay? We know, I don't know what it is like in America anymore. I apologize. I have not lived there in some time. So I don't know what it's like in terms of being able to go to the emergency room. But here, and I'm going to give you specifically about Jerusalem, you don't just hop over to the emergency room if you're not feeling well, because you will end up paying for it, and it's about 1,500 shekels for the visit. So how do you not pay for it? So first of all, on the right-hand side, you will see the when you can go to an emergency room and not have any trouble. So first of all, if you're unconscious, if you have a referral from another body, we'll say Terem, which is like a semi-urgent care unit that operates out of several cities, including Jerusalem. You have a referral from your family doctor. You have an open fracture. You were in a severe car accident. And between 1 and 6 a.m., you can arrive at the emergency room without a referral, and you can be covered. If you arrive without a referral, but you are eventually admitted to the hospital, so you will not need a referral. But I would not rely on that. So how do we get the referrals? So either we go to one of these semi-urgent care, which in Jerusalem is Terem, Yad Sarah, or if we're in Mu'chadet, they have their own urgent care clinic on Hatorim, which I have to say that I was there recently in their revised emergency urgent care, and I was very pleasantly surprised. I feel they have definitely learned from their failures, and they have much improved. And it was actually smooth and ran either quite efficiently, and I was very pleased. I wanted to give them a thumbs up. No one asked me for my review when I left, but I but I told them anyway that I gave them a positive review. Or you can also, Muqaddad has a new thing where you can go online to what they call their hybrid emergency room. They call you back, usually about after 45 minutes, with somebody who will hear your story. And if they think that you need to go to the emergency room, they'll give you a referral. And if not, they'll tell you to go to the urgent care unit. Maccabi has this, but they have a nurse who you call, and she does the same thing as well. She can send the referral on toward the hospital if needed. But the most important thing we need to learn from this is that we need to have a thought process. We don't just go to the emergency room. Before we go, we need to have a thought process if we're going yes or no, and how we're going to get there, so we don't end up with a big bill. Now, the other exciting thing that people I don't think use enough is that once you have the supplemental care of your kupa, all the kupot have this what they call bikor rofeh, which is a doctor that comes to visit you at home. This is especially helpful, I think, for older people or people who are less mobile. Whereas it might have been that if you were more mobile, you would have gone out to Tehran, but to schlep out your 85-year-old father who has a bad cough in the middle of the winter is not really recommended, whereas you can call. And as you can see, there's a copay, but if you're over 80, it's a very, very minimal copay. It'll take about between 4 to 6 hours, sometimes less, but to get there. So it's not an emergency, but let's say like, you're really not sure if the person's having, they're having breathing issues or they fell, but you're not sure if they should go, things like that. So this is definitely a good resource to know. And in the Jerusalem area, they come pretty quickly. Okay, not quick, between 3 to 5 hours. Okay, now why is Jerusalem different than any other city in terms of healthcare? So the interesting thing about Jerusalem, I think, for one of them, is first of all your access to private care, because as we mentioned before, the hospital system, a lot of the hospitals in Israel are public, which means they cannot do private surgeries. The doctor cannot see you there privately. So if the doctor's working at a public hospital, he'll do his surgery elsewhere, or he'll see you elsewhere. But the nice thing about Jerusalem is that the three, it used to be four, but now it's three hospitals that we have here are all private. So they all work with the government, but you can see the different specialists in the hospital themselves. And they're really, really excellent hospitals. And I have to say that I think that sometimes, I don't know, I feel like I hear a little bit of a negative talk. And I do understand it's difficult to access the healthcare system. Sometimes difficult things happen, unexpected things happen. But really, really, we have an excellent medical system in Israel. We have some really talented, we have good people, we have a good system. I happen to know this because not only do I work in the field of healthcare advocacy, but I come from the field of healthcare research, and I still have my hand in a couple of studies, and I still edit articles for people on occasion. So I see a lot of the research, I see a lot of what's going out there. And we're really at the top of the field in a lot of issues. And the difficulty, I think, becomes just figuring out how to navigate it, how to feel comfortable, how to sort of get over the cultural divide that happens. But the benefit of Jerusalem is that we really do have the hospitals to choose from with specialists. And relative to other cities, we do have a wide variety because we have all four of the Kupot Holim, we're very active in Jerusalem, unlike other cities which are really dominated by one kupa. We really have a variety here, which I think creates a good atmosphere of competition. So we have more choice. And we definitely have the availability of good emergency services, meaning we're not just stuck with one emergency room. Meaning we've got 3 emergency rooms plus all of the semi-urgent care that feed into those emergency rooms. So we do have a lot of choice and good choice here. So I definitely think that is a benefit for all ages for coming to Jerusalem. I have to say, I think also for older people. So I'm just going to mention just briefly, I'm not sure anybody here on this call is necessarily affected by labor and delivery in Jerusalem, but you never know. And also maybe you have children who are planning to come, etc. But we do have the hospitals, and there's a lot of options here. And specifically for a more religious crowd, it's very comfortable. Let's say more so than maybe some other cities in Jerusalem, because there's a much more understanding of like wanting to have, religious actions in the hospital setting. So if you give birth on Shabbat, or you have to be in the hospital over the holiday, that you have access to kosher food, that you have access to all of, to Kiddush and all of the other things that go along. Oh wait, no, that's the wrong way. But specifically, I think really for those over 65, even though Jerusalem is on average a younger community, I see that in the past 10 years, the city has really invested in their neighborhoods and in making sure that there are community leaders and community centers and a lot of activities geared toward older people. And in the areas where you see English speakers, there are a lot more English speaking activities and I would say community leaders who speak English, which makes it different than other cities in Israel. Also, okay, so I feel that, one of the misleading thoughts people may have when they make Aliyah is everyone speaks English. That is not the case at all. Once you leave your little bubble, perhaps of a certain very small geographic area, that is not the case that people speak English, and a lot of the medical community does not speak English either. However, in Israel, we have sort of a higher concentration of native English-speaking medical professionals. Not just doctors, but also nurses and occupational therapists, speech therapists, etc. So this is definitely something to take into account. We also have the higher, for people who would like a more religiously affiliated nursing home and independent living facilities, they're for sure way more concentrated in the Jerusalem area. And also recreational facilities for older people. You're definitely seeing more and more development of that, more parks, more activities outside. So, and I know we're going to see more of that, but I see the municipality investing a lot of time and effort to create programming for their older, over 65 crowd, and I think that's only going to continue. So I think that's something important to remember. And I don't, what, I'm not, let me just see if I have a time here. Okay, all right. So, and I'm just, I could talk about this for hours really. So, but the other thing that some of people are ask, well, what if I want to bring my parents over on Aliyah? And for sure, Jerusalem is a city that lends itself to that. I think because the ease of between the neighborhoods, I know a lot of people who might live in, let's say, you live in Harnof and your parents have an apartment in Rehavia, or you're in I don't know, you're like in Katamon and your parents are in Talpiot. So everybody sort of has their own community, but in terms of like getting to the doctor's appointment, or let's say, okay, I'm going to meet you at Hadassah, or it works out very well in a way that I haven't seen it in other cities work as well. So there's definitely an ease of doing that. And I see more and more people bringing over their parents on Aliyah, and I think that's the way that, I think it works for everybody, because, that it's hard to be far away and not have any support as you get older. And here is the ability to do both, to be in Israel, to live in a place you want, and also to make sure that your parents are getting good care. So I will not make you crazy. I know I've chattered on, but in general, because I cannot not say this because I am a health advocate, in general, just remember that these are sort of my 7 commandments or my principles, I say, of health advocacy. But I think the most important thing here I can say is remember to choose your battles. That you don't want everything to be a fight or disagreement. Things are going to be different. Things might be challenging. Things might be confusing. Decide what it is that's crucial to you. And then you can say, like, that is something that I will not let go. For example, I don't know if it's called a pet peeve or what have you, but like I I insist that anybody who takes my blood and anybody who takes blood of anybody in my family wears gloves when they're checking and before. Now, I know people in America, they might have fainted dead away when I said that, like not everybody does, but no, not everybody does. And also not everybody does in America as well. I know that for a fact. But that's my thing, and I'm willing to stand on that. Where there are other things that I will let slide. So that's a small example, but I think it's important to just remember what was really important to me and that choose that and really don't make yourself crazy about all the other things. Also, um, we must remember that we are the case manager. The family doctor, the doctor will not take on that responsibility. That will be our responsibility, and we will be managing it of our children or our parents or our spouses, etc. So that's an important thing to just sort of understand from the get-go that you are the hub. And that is it. So thank you all very, very much. I always enjoy talking about these things. I could really literally talk about them for 3 hours. I'm kind of like a healthcare system geek, I guess it is. But this is my contact information. So please take a look at the website, lots of information on that. You can send us a message on WhatsApp, or you can give us a call, or you can email us if you've got questions. Even if it's in a year from now, hold on to our email and you said, like, I heard your lecture last year, but I'm only making Aliyah now, and I have X, Y, and Z question. Um, Always a pleasure. And really, I get emails all the time, and I always enjoy answering them. So have no fear, and I will stop the share. And if anybody has any questions to ask me about anything I said or another topic.
Yes, excuse me. Deb